All right, you guys. So this is going to be a short little rant. I've tried to record this video several times. I have a couple of issues with it because of community guidelines, and I want to put it on YouTube. But basically, I had a little bit of a back and forth this weekend with a physician, Dr. Ryan Marino, MD, over on Twitter. And I wanted to talk about it because, as you'll know, true health is my purpose in life. Like Dr. Ryan, I used to practice medicine. I was a physician assistant. I practiced medicine for 6 years. I worked in the ICU, and what I saw was overwhelming. Most of people's issues were not an unavoidable, disease that struck them. They were not, a severe accident that happened, just totally out of the blue. Most of the issues that people had were exacerbations and worsening of chronic conditions that they already live with that were not being managed properly through lifestyle. And my work there in the ICU led me to the understanding that the things that I do are so wildly different from what modern medicine tells you to do that I almost couldn't even deal with it in good conscience anymore. For me, the way that I take care of my body is not by CDC guidelines in any way, shape, or form. I look at overall health and lifestyle, which is not it's not in contrast to what they're saying, but they do not focus on this. And in my opinion, the focus on true health is really the only way to maintain health. So for me, that looks like working out, strength training and cardiovascular, but not too much. So proper rest, proper sleep, proper nutrition, the healthy foods in the correct amounts, and looking for vitamin nutrient deficiencies whenever I'm having an issue, how I can counteract that, looking for a lifestyle intervention or cure, looking for stretching, different changes I can make if I'm like saying having headaches or muscle pain or any imbalances or anything like that. And how can I aid my body if I do feel like I'm starting to get sick? And a lot of that can be, tackled through kind of herbalism type of vitamins and things like that. Also, maintaining good hydration, always key. But this is how I look at any issues that come up with my body. I honestly can't remember the last time I took like an actual pill. I think it was a few years ago. I might have taken a Benadryl when I had hives all over for some reason that I, to this day, can't tell you what it is, never came back. But for the most part, even if I have a headache, which is pretty rare, what will I do? I'll look at what was I doing that day? Did I have sleep issues? Was I craned over my phone? Was I staring into the light late at night? Was I not hydrated? Did I drink a bunch of coffee all week and then stop? There are a lot of factors that matter to this. Did I eat something that had aspartame in it? Lots of factors that I can control without just reaching to the medicine cabinet for something that has the side effect of harming your liver, Tylenol, or harming your kidneys, ibuprofen. So that's me. But this back and forth that I got into with this Ryan Marino was about, the HPV preventative product. He basically said he was so happy to be in the clinical trial for men, and then also that he, jumped right on the 9 strain version when his doctor recommended it to him. And that there's basically no reason why anyone should say no to these products. Otherwise, they are pro-cancer, which I thought was hilarious. I am absolutely not pro-cancer. I am pro your immune system getting what it needs to stop cancer as it forms. So basically, you actually have immune cells that their entire job is to go around and look for any little cells that are getting out of line. They're over replicating, they're abnormal. These cells, when your body is given proper nutrition, proper rest, proper care, it's not assaulted with outside chemicals and stuff like that. Their job is to circulate around, find those cells, and stop them before they create cancer. So that is my main focus always. You want to not smoke. You want to not drink alcohol, except for very, very rarely occasions, maybe. You want to give your body rest, nutrients, everything it needs to function as properly as possible. So then we can get into some of the issues with this HPV preventative product. We know that there's actually been a lawsuit that's still ongoing against Gardasil where it sounds like Merck kind of overstated how helpful this product was and understated, or I guess like falsifiably lied about, is what it sounds like, some of the adverse reactions. So these companies are absolutely for profit. Merck did not take the Hippocratic Oath. Their job is to sell your product and to serve their board and their people who are invested financially. None of that has to do with an ethical commitment to the patients. They do obviously get punished when they are found to lie or do something, that is unethical, but their mission is not, driven by that. Their mission is driven by profits, and we have to keep that into account when we take their advice. Now, a lot of people attacked me and said that I should not be trusted because I have a program called the 6-week reset that's designed to help people learn over just a short 6-week period how to take care of their health. They thought I shouldn't be trusted for that because I charge a couple of $100s, and because I talk about how you can be the master of your own health, but obviously I also have to make a living. I found this pretty funny because they should understand that I actually used to make 6 figures when I worked in healthcare, but through good conscience of what was actually going on and wanting to be able to speak on those topics and stand up for what I actually believe in, which does not always have to go hand in hand with what certain organizations want you to say. I actually left that 6 figures behind and have decided to charge reasonable prices to teach people about true health. So it's a little funny that people call me a grifter for that, especially when we know that Dr. Ryan Marino is a physician and he makes his money as a physician, which is very tied to, pharmaceutical products and everything. But I won't get into that. People can say what they want. I know the truth. The truth is that it doesn't take a long time to teach people how to properly care for their body, but there's so much misinformation out there about, should you fast a whole bunch? Should you do this? Should you do that? Should you limit carbs? No, like you shouldn't. There are very, very common sense ways to take care of your body. And that is like my 100% my mission of like what to teach people. Okay. But it was a little bit interesting because we got in this back and forth. And what he misses is that there's, first of all, side effects associated. And so that is always a reason why you can be anti these products, because you don't want a side effect. There's also a lot of questions about how effective are they. I found one study that talked about, like they tout some statistics saying, 90% reduction in, cancers from HPV. But then if you look, they only tested the women till 31. The absolute numbers of women who are actually, diagnosed with invasive cervical cancer under 30 is so tiny. Even per year, this other breakdown that I found, women, it was like, I think between 30 and 34, I believe. There was only about 1,000 per year that were diagnosed. Like absolute numbers. That's absolute numbers in the US between 1999 and 2008 per year. Not for the entire time span. But those numbers are pretty tiny to be going and putting a shot in every single person out there. Another thing that we know is that when the body and the immune system works properly, HPV, which is human papillomavirus, is almost always cleared on its own through the healthy immune system. If you are supporting your body, then your body should be able to fight this off without needing a bunch of procedures or having it develop into cancer. That is just been prevailing fact and opinion for a long time. And then as these shots came up, now suddenly we're just forgetting all about your immune system entirely. But other than that, I did bring up the point of back in the 1950s, V products were accidentally contaminated with a virus called SV40 because, as we know, lots and lots of V products are made either with human cell lines or animal cell lines or on animal serum agar. So there's a lot of room for contamination of genetic material and viruses. And we have at least one example that is very glaring of SV40, which was a cancer-causing virus from primates that made it into the V products for polio that went out to millions of people. And it has been decades since they figured that out and fixed it. But there's always room for this type of error. There's always room for this type of issue. And it did happen. So lots of organizations have tried to say, oh, it didn't necessarily increase the rates of cancer, but we do know that cancer overall has gone up, soft tissue cancers as well. And there have been times when they've looked at some of these different tumors and actually found SV40, virus they've isolated from the tumors. So there you go. So my point is that doctors need to look back at this Hippocratic oath and say, am I accidentally serving a for-profit company just because that for-profit company then kind of took over the governing body that I work under, which is like the CDC, medical board, whoever hands out, whether it's, the pediatric group that hands out like this is standard of care. Is this chain defiling what I'm telling my patients, or do I actually believe this stuff in good conscience? That's something that only they can actually, tell you. But I would believe that their opinions are kind of corrupted by this chain and flow of knowledge. And that people need to understand that patients, these people that practice medicine need to understand that patients actually deserve true informed consent. They deserve to make decisions that are not the decision that you want them to make, and they are entitled to alternative data and facts as opposed to just what your group tells you to believe, because the truth is always somewhere in the middle. I can say these statistics, he can say these statistics. The truth is a continuum, and it's going to be different for each person, and that's why each person deserves to hear this side, deserves to hear that side, and then make a decision based on what their lifestyle actually is, what their risk actually is, how they live, and then make the decision that works for them. That is the best way to approach healthcare, and there shouldn't be pressure put on patients or on people to pick a side and basically say, you're anti-V if you personally don't feel that you need this product. Just saying. But that's about all I have to say about that. I am hoping that Dr. Ryan Marino will want to debate me and do a little bit of a chat, either here on YouTube, Instagram, wherever, maybe even a spaces over on Twitter. I'm not afraid of someone, arguing back, pushing back against me. I think we could have a really good conversation. So hopefully that will make it to him. I've asked him basically through a couple of different routes, will you do one debate with me? I might send him a message, but we will see. So if you like this video, definitely leave it a like. Thank you all so much. If you have any questions about, lifestyle interventions for your health and how to take care of your body, please reach out to me. My DMs are always open on Twitter and especially on Instagram. It's a lot easier on Instagram because I can send you a voice message back. Otherwise, if you want to see that debate happen, tweet it. Hit a tweet, say, Dr. Ryan Marino, debate that Liberty chick on this topic. And if you want help getting your health in line, feel free to join my 6-week reset, or like I said, reach out to me with questions. But thank you all so much for listening to this video. I hope you all feel empowered to ask as many questions of your healthcare providers as you have come up, and use your knowledge to accurately evaluate what they're saying. Use some discernment. Go check what they say. Go look at a different source. Go ask in a different way. Only you live with your health decisions, not your doctor. So it is important for you to always feel good about the choices you're making. Again, I hope y'all like this video. If so, definitely leave a comment, and I will be back soon.